Hi, this is video number 2 in the Preceptor training series. We're going to talk about coaching and teaching techniques. Some of these you may be very familiar with if you've been a preceptor before or if you are a nurse educator. So most of it's going to be reviewed, but we'll go over a few things and highlight a few very important things to do with nursing students. These are some strategies that I want to go over, and some of them you're definitely very familiar with, and others may be new to you. One of them is Socratic questioning. It's very important when we are teaching nursing students to use open-ended questions that can help them to think critically and reflect on their own reasoning rather than just providing an answer. So if a student comes up to you and asks a question such as, "What does this medication do?" It would be a great thing to say, "Well, what do you think this medication does?" Or let's talk about what this medication does. So it's important to use this as an active engagement tool and to help the student to think more deeply and actually apply things to real life situations. So instead of telling the nursing student exactly how they should handle something, ask them a question, have them have a conversation about it. The next one that we use a lot in the nursing program and as nurse educators is scaffolding. It's important for us to understand where the students are starting and then go from there. So we know that they start out as novices, as nursing students. They also start out as novices, as nurses when they graduate. But what we want to do is build on their knowledge. We scaffold their learning so that they build their skills and their level of engagement and the challenges that they receive should increase as they go forward. So you might be able to initially guide a student through a particular procedure, step by step, showing them how to do something, offering advice, giving them cues on how to do it best. And over time, as they gain experience and confidence, you should be able to step back and let them complete those things more independently and offer less direction. As a preceptor, it's extremely important for you to use your experience and your knowledge to help them understand what is really happening in the world. Your experiences as a nurse are real-life examples of how they are going to put what they have learned as theory into practice. Being able to help them connect what they have learned in the classroom with what is actually happening in the hospital while they're giving patient care is definitely going to give them a deeper learning of what is actually happening in nursing. The best way to do that, if you don't have specific real-life case studies, real-life experiences, is to create a case study. Take something or a patient that you've seen before, a particular diagnosis, particular medications, particular procedures, and put it into a case study so that the student can think through it. What they can do is take it from the beginning of this patient came in with congestive heart failure. These are the medications that we're giving the patient. This is what we did to help them. These are the skills and the things that we did, and then go through and help them to problem solve as they're going through this evolving case study. Another very important part of education with students is giving them time to self-reflect. Having them reflect on what they did, what their performance was, what went well, what are some areas for improvement. But self-reflection really helps student nurses develop self-awareness. It promotes their critical thinking and it allows them to become more autonomous in their learning. It's very important for you as the preceptor to ask the student, what do you think went well? What do you think you could do differently next time? It helps the student to reflect on their performance, and as they gain more experience and more performance time in clinical with you, their confidence will definitely grow. This one I'm sure that you know. As a nurse in the hospital, you understand the teach-back method because we do that with our patients. It's a great way to help a student learn using the teach-back method. So It helps them to be able to understand and reinforces their learning by being able to teach you something that they have learned or something that they have gone through. It helps them to figure out what the gaps are in their own knowledge and skills. If they can explain to you how to do something and then have you teach it back to them, then both ways it's going to help. So going through the teach-back method with your nursing students is just as important as going through the teach-back method with our patients. Clinical reasoning is one of the key terms that we use in nursing education now. And this definition by Patricia Benner and colleagues is an excellent one. Clinical reasoning is the process whereby nurses use clinical judgment and critical thinking to make decisions based on both knowledge and experience. It is the ability to reason as the clinical situation changes, taking into account patient trends and trajectories. An important part of this statement is that they make decisions based on both knowledge and experience. As a clinical nursing student, they don't have that experience. They are still gaining the experience. So as the preceptor, you are helping them by sharing your experiences with them so that they can really connect what's going on with patients. These students, again, they are pre-licensure nursing students that you're going to be working with. And what we're hoping is that as they develop clinical reasoning, it will give them a great segue as an entry to practice. We all know that students graduate and immediately they start working, so there needs to be a foundation in nursing education where they can draw from their experiences. A lot of times we have seen and research has shown that students enter practice without ever having taken care of an unstable patient, or they have never taken care of a patient who coded, or they have never taken care of a patient who has actually given birth. So what we need to try to do as the preceptor is find experiences for them that are going to increase their knowledge, increase their skill. We need to try to look for things that are going to challenge them. But as you share your experiences as a nurse, your clinical decision making provides them with real life examples to guide their own clinical decision making. I have a couple of videos I'd like you to watch, and the video is of a clinical instructor and a nursing student, or a preceptor and a nursing student. And I want you to watch and listen and see what did the preceptor do well and what did they not do well.
Okay, why don't you go ahead and tell me about your assessment, but let's do it like you were doing change of shift report. The more practice you get, the easier it's going to be.
Sure. So the patient was admitted through the ED in third-degree AV block. He came up to the unit after having a transvenous pacemaker inserted, and he's having pacing at a rate of 70 with the temporary pacemaker. He was scheduled for pacemaker implantation today, and he returned from pacemaker insertion about an hour ago. His current vital signs are blood pressure 110/70, heart rate is 70 and he's pacing, respirations are 20, and O2 sat is 98% on 2 liters. His arm has been immobilized and he's resting in the bed waiting for his lunch. I'll be finished with post-procedure vitals in 2 hours, and he'll also be off bed rest in 2 hours.
Okay, very nice job. That was very organized and very clear, not only about what you found, but also about what you did with that information.
Thank you. It's getting a lot easier with practice.
It seems like you've had a lot of patients with similar diagnoses that have been pretty stable. I think I'm going to start working with the charge nurse to go ahead and get you some different diagnoses and maybe some patients that are a little less stable and who need a little bit more intervention.
Okay.
But for now, let's go ahead and think about what are the possible complications that could happen with this patient.
Okay.
So let's say you walk in the room and you look on your monitor and you notice that the patient is hypotensive and the blood pressure is in the 80s. What would you do?
Well, I guess I would do a quick focused assessment on his vital signs and check his telemetry.
Good. What would you do next?
Well, I guess I never thought of that. I guess I would call the provider.
Is there anything else you'd like to do prior to calling the provider?
In this particular video, the preceptor or clinical instructor made sure that she took time with the student in a quiet place to focus on what happened during the clinical day. This is a quiet time to sit and talk about teaching and stimulates the clinical reasoning of the nursing student. It's much easier to sit down in a quiet place where there aren't interruptions, either after the shift or before the shift or sometime when it is a dedicated time to sit down and debrief, basically, talk about what happened during the day. Using varied learning techniques are also important. So asking what if questions, those are great ways to find out if the student knows something. What else does the student know? What if this happened? Oh, so this is what actually did happen, but what if this happened? It takes the student's knowledge and clinical reasoning one step further in the process, because you as the preceptor know what could potentially happen. The student doesn't. So taking them through that process of thinking what could potentially happen is extremely important. This type of debriefing situation or dedicated time to talk is providing formative feedback to the student, telling the student as they're going how they're doing. Try to start out with saying something good. So in this situation, the clinical instructor or preceptor said that the student's report was organized and clear. So she provided great feedback that was positive, and then she gave her some areas that she could continue to work on. So giving some good feedback that is positive along with some opportunities for improvement are important. Then the preceptor started to say, well, I think there are some other things that would be good for you to see. So let's look into talking to the charge nurse and maybe getting you a different kind of assignment. Let's give you some different patient care experiences. Let's get you into some things that are good learning opportunities for you to broaden your scope and start thinking more about what it is that you can do as a nursing student. But these are really important ways to ask, what does the student need at this point? There are some times when a student has the opportunity to take care of 6 patients in a row who all had sepsis, or 6 patients in a row who all came in with heart failure. So this preceptor recognizes that a lot of what happened with this student, they've seen patients like that. So to improve their knowledge, to improve their clinical reasoning, let's give you a different kind of experience. So going to the charge nurse and asking, can you give us a different assignment the next time, to really broaden the student's knowledge. I have another video for you to watch, and there are a couple other different strategies that the preceptor puts into play. And so we'll watch this and then talk about it.
So is there anything you might do prior to calling the provider?
Well, I might also check their mental status to see if they're symptomatic. Oh, and I would lower the head of the bed and raise their legs.
Good ideas. At this point, we should also probably consider what are the causes of the hypotension. So we need to think back, like, was there any blood pressure medications that might have been given, or even is there any signs or symptoms of bleeding for this patient? What do you think might be the particular issue for this patient?
Well, I did give Coreg this morning and Norvasc, and he was also NPO for the procedure since midnight, so I should probably check back and see if he might be dehydrated.
These are great ideas when thinking about contacting the provider. Have you ever had any practice contacting a provider?
Well, no, but I know you're supposed to use the SBAR format. You know, I practice it a little bit in school.
Yes, that's actually a really helpful tool, and I actually went ahead and printed you out some information from the Institute of Healthcare Improvement, and I went ahead and printed out this practice tool. This has a lot of good information about what is needed when reporting in this way, like what the provider might expect to hear from you. So why don't you go ahead and practice doing an SBAR on this patient, and then we can act like I'm the provider and you can practice.
Sure. Do you think I would be able to practice actually giving an SBAR report on patient issues to the provider?
Definitely. We can go ahead and move that to the top of our goals list for the coming weeks.
Great.
So as we looked at that particular video, the mentee or the preceptor was actually helping the student to think through what was needed to be done for patients. She walked through the actions that she needed to do before calling the provider so that she would know how to be prepared. She asked open-ended questions, and she encouraged the student to think about what she was going to do while she provided guidance. She gave some positive feedback, and then she gave some areas for constructive improvement, and she's really being a coach. She asked the student about her prior experience, what she has done before, to get a grip on how she's going to go forward. She needs to know what she did before so she can build on those experiences. She also brought in some evidence-based information. As we always try to say to our nursing students, we do what we do as nurses because it's based on evidence. So bringing in some evidence-based tools is going to be a very helpful way to explain to someone why we do what we do. Active learning strategies such as role play, where the preceptor was saying, let's practice that. You can be the nurse calling and I'll be the provider, and we'll go through that and we can really decide how to do this. It gives you a little bit of experience how to do it before you're actually doing it in practice. And this preceptor was definitely very focused on what the students' goals were for learning. Very important for us as preceptors and educators to know what our students' goals are and how we can help them meet those goals. Another thing that we can do to help us create questions and figure out how to deepen our students' understanding and take them from knowledge all the way up to synthesis is Bloom's taxonomy. And you've probably heard of this as well. What we really want to go from is having them basic knowledge. And we can also say this is the remembering phase. They remember the facts, they remember concepts, and they need to understand what those concepts mean before they can move up to application. What we really want them to be able to do is master the content, master the knowledge, so that they can use clinical judgment to apply that knowledge to situations where they may be acting under pressure in clinical or in practice. We intentionally want to move our students from memorization, memorizing knowledge, memorizing facts. We intentionally want to move them up the ladder, at least to application and then to analysis. Memorizing clinical facts is not going to help a clinical student or a nurse be a safe practitioner. Our main goal is for them to be able to apply the information so that they can safely provide clinical care to patients. And patient safety depends on a higher order thinking. If they are able to take information, apply it, analyze it, evaluate it, then they can keep that patient from deteriorating, they can help that patient get better, and they can have successful outcomes for all of their patients. On my next slide, I have an example of a real-life example using Bloom's taxonomy. So we'll take sepsis. The knowledge of sepsis is being able to define what is sepsis. What are the criteria for sepsis? What tells me that my patient is septic? Comprehending it is being able to understand, what does sepsis mean for my patient? What is going to happen with my patient after they become septic? Well, sepsis often leads to organ failure. The application is being able to identify sepsis when there are different patient scenarios. So maybe as the preceptor, discussing patients that you have had in the past who were septic and explaining to them, what was the scenario? What did the patient come in with? What were the patient's labs? What happened for when the patient was in the hospital? And then the analysis is looking at labs, looking at vitals, and looking at other things that are happening with the patient to be able to detect that this patient is not doing well. We know that sepsis can have very poor outcomes, and we want our nursing students to be able to understand when they become nurses that it's important for them to detect when something is not going well, when a patient starts to decompensate. When the patient starts to decompensate, we want our students to understand it's time to ask for more help. We need to escalate the care. This is evaluating what's going on. This is making a clinical decision based on their knowledge, what they have applied before, and what they have analyzed. And then finally, the synthesis is when the student is able to develop a full plan of care for a patient who is septic. We're going to do a little knowledge check now. I have a question, and this is kind of related to Bloom's taxonomy and how we have a higher order of thinking going forward. So, which question does the preceptor ask to determine the nursing student's ability to apply their knowledge of the nursing care for a post-operative patient? So we think, the first one, what equipment will be required to assess this patient? How will you monitor the patient's progress? Can you compare this patient's post-operative orders to our last post-operative patient? What are the most common complications of this procedure? As we go forward, we see asking about the equipment is knowledge. This is something that a student could have learned in their first semester of nursing school, in any kind of a class. It's what is the equipment? That is basic knowledge. How will you monitor the patient's progress? Is taking the knowledge that they have learned about postoperative patients and looking at what could potentially happen. What do I need to look at to make sure that this patient is safe, that this patient is making good progress? Then going up to, can you compare this patient's postoperative orders to our last postoperative patient? This is really going one step deeper into the clinical reasoning, critical thinking, whole attitude of, let's take this case, compare it to this case, and analyze what it is that told us that this patient was doing well or not doing well. And then again, D, what are the most common complications of this procedure? That's basically knowledge again. That's information that a student could have learned in class. They could have been tested on in class. And it has not really gotten to the level of really delving into the deeper learning. So this is the end of this video. I hope that this has been helpful, and